our own ability to cope within that moment. And disrupt our sense of safety, control, and security, not necessarily always in a physical sense, but in a psychological sense or even an existential sense in some occasions. And it often can lead to, not always, but often can lead to feelings of fear, helplessness, or loss of control. Primarily, the function of trauma, deep down, it's a good one, even though it doesn't feel good. The purpose of trauma is to help us learn. When we go through really deeply distressing things, the purpose of traumatization from an evolutionary perspective is that we can learn that something has been really distressing and really bad for us, and therefore we should try to avoid that thing in the future. Of course, that doesn't apply to all of the things that traumatize us. There aren't necessarily the things that would deeply distress or overwhelm us these days are not saber-toothed tigers, lack of resources when we go out hunting. Some of them are, of course, particularly in the scope of genetics and genetic conditions, not things that we can necessarily avoid or look away from. And so you can see how, while there can sometimes be a good function of trauma, certainly historically, to let us know, oh, that's a danger, let's stay away from it, that really isn't helpful for us with a lot of the stressors that we experience in today's society. And that's why trauma does cause us so much difficulty, because our bodies and brains are wired to respond to threats in this way to keep ourselves safe. But of course, that doesn't apply to the stressors that we experience today. To get a bit more specific about trauma from healthcare, we understand that there are a number of different factors involved inherently in accessing healthcare that can be innately traumatic. What we also know is that it's not just for the people specifically involved, but also for those caring and supporting, whether that's through family or community or friends, or even for the people who are working or volunteering to support these people, to that secondary vicarious trauma as well. This conversation extends really broadly to a lot of people. Some of the symptoms, this is not exhaustive, that we can see come up around trauma from healthcare in particular can be hypervigilance and anxiety, a lot of ruminating or constant thinking about a condition or what if scenarios related to it, avoidance behaviours, perhaps not wanting to engage in appointments or make decisions or have conversations because it is a really overwhelming thing to do. Sometimes some numbness or detachment, and also depending on the experiences that people have had, some difficulty, forming trust with healthcare providers and also expressing needs. Certainly, there's a lot of systemic factors within healthcare that can contribute to that as well. So trauma-informed care, in understanding what trauma is an approach that firstly acknowledges the impact of trauma, and that the impact of trauma can impact a range of areas of our life. But secondly, particularly if we're thinking about healthcare, recognising that trauma can certainly be something that shapes how we engage or don't engage with the care that is available. So this can impact the way in which we're engaging with or not engaging with health services. And lastly, I think, and possibly the most important point of trauma-informed care, is that this orientation accepts that there are, systemic pressures and parts of the healthcare system that can be inherently traumatic for people. The way that things are organised, collated, the access that some people might have to healthcare that other people do not, and how all of this information can be discussed, how much support is available. We know that, for example, finding mental health support for people can be really challenging and really costly, certainly at the moment, but historically as well. And so trauma-informed care really acknowledges that there are a lot of aspects related to accessing healthcare that can be inherently challenging for people. And trauma-informed care can be provided when we continuously improve our practice by incorporating its principles into our service delivery. So I tend to think of trauma-informed care as not a box we can ever really tick, but something that we're continuously working towards, continuously reflecting on in terms of how we're delivering something, in terms of how we're talking with someone, in terms of how we're engaging, what are the ways that we can be more trauma sensitive to people. The other thing that trauma-informed care does as well is acknowledges that outside of accessing healthcare, many people also have trauma histories themselves, and that also will be impacting how they're able to engage in healthcare also. So being sensitive to the idea that some people who are coming to us already have had some really distressing and overwhelming experiences in their life already. In terms of some of the principles of trauma-informed care, these are some of the areas that we can ask ourselves about to try to think about how we can better, achieve or meet some of these principles. I don't think it's something, again, that we can ever fully tick off, but they're ones that are useful for us to be aware of. So the first one is safety. And really how we can create an environment where people feel physically and emotionally safe. Now, one of the ways in which we can do that is inquiring from people if there's anything they think that they might need to engage in a healthcare service that they're worried won't be there. These types of questions are really open and don't, presuppose that we necessarily know someone's history, because often we won't, certainly not in maybe full detail at the first time we're meeting with them. And so just exploring what some of these things would be. Trustworthiness and transparency. I've put transparency and trustworthiness together because trust inherently is something that's built over time. And for many people that are working in this space, for many people who are accessing services, you might not actually be frequently working with the same person. And so what we know from single session therapy or single session work is that where trust can be difficult to form because maybe we might only meet with someone once or twice, or have different, rotating professionals. Transparency is what a lot of consumers from all sorts of health services will often talk about as being an important outcome, acknowledging that they may not, after 50 minutes, have a full, trusting, in-depth relationship with one of the practitioners that we're working with. So really just trying to think about how can we be open, honest, and explanatory in the care that we're delivering, what they might be able to expect from that appointment, things like agenda setting, letting the person know before, attending on site, what they might be able to expect for a lot of people can be, really, really helpful. Peer support. So this question here can be about how we can encourage connections with others who may have similar lived experiences. And so part of trauma-informed care is also acknowledging that the experience of a consumer is quite different to the experience of a professional, and how we can start to share that in big and small ways. So for many people as workers, it could be using things like affirmations and normalizations. A lot of people that have come to see me have often said that they find finding out this information to be really distressing or really worrying. So little things that we can do just in our conversation and interaction, but of course also support groups, or other resources that we might be familiar with that have been either developed or co-created by people who have those experiences. Collaboration really around how we can work together, and some of the questions that we might ask here would be, if I was to be an effective support for you, or if I was to be an effective insert name of role here, what would I need to be doing more of or less of, and trying to understand a little bit about how we can do that a bit more. Voice and choice being really important. So we know that helplessness, lack of agency and control are factors that increase the risk of traumatization for somebody. So where somebody is able to have choice and able to have voice in the decisions and the discussions related to them, can actually be a really important factor to how they then cope afterwards. So, there's a lot of things that the person won't be able to control, but maybe, if we found, instead of saying, here's someone that we can link you in with to support, we might be able to say, here's a couple of options that I've found, what do you think? Small moments like that can just help somebody feel a little bit more in control of what's happening. A really micro thing, sometimes, if a very different example that I'm giving, but just how some of these small moments can make a difference. If I've got a lot of things on my plate and a lot of things to work through, sometimes me making a list can just feel a little bit better, because I've got some sort of control and oversight as to what's happening. Very different example to what we're talking about here, but just those little things can help us with our coping. And also diversity. Now, diversity, I really like to think as well of difference as well. So how can we value diversity and difference of all the people involved, acknowledge that, and have that as something that we can discuss? So one question I think that can be really helpful for us to ask people is, especially early on, is there anything we haven't yet discussed or mentioned that you think would be helpful for me to know in supporting you? A really nice open question. You get some really lovely surprising answers from people about what they might choose to include, any worries that they might have. That free association of where their mind goes when you ask them that can help address some of those worries. But also prevents us from making assumptions about what we think the person, might be needing or worried about as well. I have a slide here that talks about how we can explain the impacts of trauma. It's very text heavy, but the slides from this will be provided to you. I have probably the most important part of this is I've got a little note at the bottom that says, this is a script just as an example. We don't probably want to be reading this out word for word, but I've just sort of given a bit of language to it that each of you could, modify, make it your own, and kind of hear what it could sound like so that you can then adapt it to, what your client or what the example might be needing. But often explaining the impacts of trauma, it's helpful for us to first acknowledge the emotional response, explain what trauma is, and how that can impact people. Then try to relate how this current event could be something that some people may experience as traumatic. We may not know if that's the impact it'll have on them, but just explain that for some people that may be how it occurs, and some of the bodily responses that might go along with that. Because sometimes people tend to think that what's happening in their body may not be connected to what's happening in their mind. Instead of normal the experience, normalizing the experience by saying actually all sorts of reactions to difficult or challenging news are really common, and a lot of people will experience this and there's no right or wrong. And then lastly, offering that reassurance and support. So this will bring me to my next point, which is around where we think that trauma could be at play. There are some specific trauma-focused therapies that we'd probably be recommending to clients to help assist with that. And that just brings me into my last couple of slides. EMDR therapy is recommended by the World Health Organization as the level 1 evidence-based therapy for post-traumatic stress disorder and trauma. I tend to really like this, particularly in the genetics and genetic conditions space, because it isn't about telling people they need to think differently or feel differently about what it is that's going on, but really looks at how some of the symptoms related to what's going on could be reduced for them, and really their own mind doing a lot of the work in trying to integrate this new information they have about themselves and what does that mean for them. In terms of finding a therapist, and this links into that trauma, where do I find someone that works with trauma? The EMDR Association of Australia, there's a find a therapist list there that everybody on that list has at least 6 full days of training specifically in the EMDR protocol. And so people can find, someone close to them that is able to offer that. And some of the things that it can be used for can be addressing, taking some of the intense emotion and fear out of distressing memories. So maybe where someone found out news, reducing some of the anxiety about future-oriented scenarios. So maybe if I've received this diagnosis, I might be really worried about this what if, and that then might make it play on my mind quite a lot. EMDR can just help reduce some of the anxiety and distress related to that, not telling or suggesting to the person that it wouldn't happen, but whether I think about it 24 hours a day or not, it doesn't change that possible scenario. And so just helping people to reduce some of the symptoms that they experience that get in the way of them living a meaningful life day to day and in the moment. Also around guilt and self-blame, and potentially if there are any other, particularly around medical trauma that they've experienced that makes it really challenging for them to go to appointments, to take up particular treatment options, there can be some reprocessing around that as well. That was the last of my slides, and I do apologise. I think I went a little bit over time. But any questions, I'd be happy to take those later as well.
Thank you so much, Anthony. I feel like you really lifted a veil for us as community, but as professionals as well that are here on the call, looking at what people are thinking about as and how they are structuring an appointment or that we're coming to you to talk about, and that's not an insight we get as community too often. So thank you so much for that. We will certainly come back with questions, but right now we've asked Anita and Lyndon as 2 genetic counsellors, as people that community are often, not as often as community would like, as well, because our genetic counselling workforce are really important components of our rare disease journey. So we asked Lyndon and Anita to from a genetic counselling point of view, to talk to us about how do you go about thinking about trauma-informed, and can you give us some insights into how the principles and how that area of trauma-informed clinical care is apparent in the role of genetic counselling. So I'm going to hand over to you both.
Thank you. Was I going first, Lyndon?
Yeah.
Yep. So we've just got a few minutes at the moment, which is good because I think Anthony's probably covered a bit of what we're going to talk about anyway. But I'm just going to sort of introduce who I am and the work that I do. I'll hand over to Lyndon to introduce himself and the work that he does and kind of the the theory of practicing trauma-informed care in genetics, and then I'll spend a couple of minutes just talking about in practice how we as genetic counsellors sort of incorporate that theory into what we do. So I'm a genetic counsellor. I work at the Monash Hospital General Genetics Clinic. So we see a whole range of different people with genetic conditions or a possibility of genetic conditions. So we see kids and adults and pregnancies and people thinking about reproduction. So I personally do a lot of work in the prenatal space, as well as the neurogenetic space. So I see a lot of pediatric neurogenetics, and also in the last couple of years have been working a lot more in the acute care space. So when babies are in intensive care, and genetic testing might be able to help them in a very quick way with their sort of treatment and prognosis, we're able to now do very rapid genomic testing, which is amazing, and it really helps with that diagnostic odyssey journey, but also it is very fast, and so there's a lot of counselling around getting a diagnosis in a very quick time frame as well. So I do a lot of work with parents and their children and the families around genetic testing and getting a genetic diagnosis. So that's me. I'll hand over to Lyndon to talk about himself.
Hello, everyone. Thank you for having me today. And thanks, Anne. I could listen to you talk about all of these things for forever. And it's such a shame that everyone else has to listen to us. But anyway, I have I actually got a couple of slides because I wanted to give some context to the work I'm doing and I guess the lens through which I'm looking at this type trauma-informed care. So I'm going to share a couple of slides. I'm a genetic counsellor working at the Victorian Clinical Genetic Services, but primarily in rare disease in the Children's Hospital clinic. But most of my work is through the RD Now program, the Rare Diseases Now program at the Children's Hospital. So I wanted to quickly tell you about that just with some slides as context. I hope this isn't too boring. But the RD Now program, can people see that? Yeah. The RD Now program is in essence looking at children who've come into the Children's Hospital, have had a suspected genetic condition, but remain undiagnosed after, I guess, all of the clinical tests. And in essence, we're looking for diagnosis. But the overall mission of the sort of program is to sort of build infrastructure around this, discover new genes and give explanations for families, but also link different clinicians, different parts of our campus together so that everyone is working well together and optimizing sort of our use of, generally it's genomic technology, although we're moving into a few other newer types of technology within the last year or so. But we've in terms of the program so far, we've had a few hundred people in it. About 135 of them are complete, and we've got diagnoses for about 75 of these families, which is about 55%. So these are people that have already had a long, potentially a long diagnostic odyssey, and we're getting answers for people after a period of time. Now, some of the work that I've done in this space is with parents who've gone through this process. We had a pilot program called the Undiagnosed Disease Program, VIC, and what struck me is we did this work with two groups, so parents who received a diagnosis and parents whose child had remained undiagnosed after participating in a similar program. And what really struck me about this whole process is that trauma-informed care is relevant at every single part. by which I mean there's this long period that people know about in terms of the diagnostic odyssey. And within that diagnostic odyssey, there will be moments, there will be specific traumatic events, but there will also be the ongoing, I don't know, uncertainty, what is going on, are bad things going to happen questions. And then they come into our program, and then we're sort of getting answers, or we're offering genomic testing, and then we're getting results, but there's relief, there's disappointment, we wanted to know more, this hasn't changed our day-to-day basis life, or maybe it has, but the feelings between the two different groups were similar, even though for different reasons. So you might be relieved because you have ruled some things out, but you're disappointed because you didn't get an answer for your child's health issues, or you might be relieved that you got a name for your condition, but it's so rare that there's no one around who understands what you're talking about. But there was this idea of seeking connection and moving towards hope and acceptance of your situation for all of these parents. Those things that Anth was listing so beautifully around creating a safe space, using accessible language, being your authentic self, and empowering parents to make choices. All of those things which mirror the trauma-informed language are things that I notice are relevant and useful for families in this situation. And families were telling us that, right? So that's what we're hearing from them. So I guess I've been thinking about how trauma-informed care is something that we've probably been thinking about without having a name for it. And yet I feel like I am learning a brand new way of looking at this whole job. I guess through, I've seen a couple of talks from Anth about this type of thing, and all of a sudden I have language around it to be using in this space. So I'm kind of excited. So I'm going to leave that there and pass back to Anita if you've got anything to add.
Yeah, so thanks, Lyndon. And I think I was just going to add a few notes on, in the genetic counselling room, how it actually looks. And I think, as Lyndon said, hopefully all of us as genetic counsellors are practicing trauma-informed care with everyone that we see. And what that kind of looks like is, before we even see the patient, thinking about what the traumas could be and where people are coming from and what experiences they're bringing to the appointment, and thinking about from the get-go how we might set up a safe space for them. If hospital might be a really traumatic place to be in and we don't need to see them face-to-face, can we do a telehealth appointment, or at least acknowledging that it might be traumatic to come into the hospital, kind of acknowledging all of that when we first see them and checking in with our clients and patients around how they are, how it is for them to be here, and setting, as Anth was talking about, setting that mutual agenda around what we feel like we need to cover in this appointment, but really what do they want and what are they hoping to get from this, and what are their fears and questions around it all as well. And then it's all about continuing to check in along the way, reflecting back what people are saying and making sure that we're understanding what they're saying and getting it right, and not making any assumptions or judgments, but ensuring that we're all kind of on the same page, and getting it all right. Active listening and normalizing that, the trauma that they're experiencing, normalizing the reactions that they are having to a traumatic event, giving them the time and the space to explore all of that and how they're feeling. And as genetic counsellors, we try and allow for time to go into exploring how people are, the supports that they have, what they need to help them get through everything, what genetic testing may help with, but may bring up extra fears and anxieties, and how we can help support them through that. and then, you know, validating all of their feelings. And I think the end of it all is giving them some of that trauma-informed education and where to go from here. So trying to make sure that, you know, we are not ongoing mental health care professionals. We do only see people for a short period of time, but making sure that when they leave us, they know where to go and have the right supports around them. So a big part of our role is referring on to different support groups and to other mental health care professionals and thinking about mental health care plans. So I hope that that's what we're all doing with everyone that we see. And I think having, as Lyndon said, having the language and the theory around it is really helpful for us. So happy, thank you for having us involved in this conversation, and more than happy to take any questions.
Thank you so much, Anita and Lyndon, because that after hearing Anthony and then hearing you talk about how it actually plays out in the genetic counselling role and how you actually use those principles, it's so insightful for us to understand how you may be preparing for your engagement with different people coming in to see you for different reasons, and how these principles can apply across those. So I'm going to start. We did put the Slido in the chat, but perhaps if I'll ask a question and then I will also share my Slido slide so that people can actually scan the QR code as well. But let me ask the first question. And the first question that I would like to ask is, how does self-care for individuals and families, how can that be factored in? Because in the trauma-informed care area, and I'd like to ask each of you that question, because it's great to have professionals that are thinking about those principles and taking people in the appointments through those series of exploration, but people then leave and live in their own ecosystem and live with that trauma. And as you said, there is no right or wrong way that people are experiencing it, but how can self-care be factored into that? So an open question to the three of you. And in fact, Anthony, I'll ask you to start off the response to that, and I'll just share the Slido slide. Thanks, Anthony.
Yeah, so I think self-care is really important, and the research is quite clear with resilience that and resilience has quite close links to trauma as well. That resilience needs to be developed and maintained prior to a traumatic event for someone to get the full benefit of it after a traumatic event has occurred. And that's a big shift, I think, for us in society, because we often think after something quite terrible has happened, that's when we need to get all of our coping strategies activated and used and all the rest of it. And yet the research says to us, actually, doing all of the things that keep us well on an ongoing basis is what actually helps us prior to an event. Now, that's not a bad story to say that it's not worth doing afterwards, but we are likely to still, it's something, self-care is something that isn't a one day, it is a practice over time. And I think the PERMA Plus model within positive psychology brings a really nice lens as to what's required of us for self-care. So the PERMA Plus model talks about how I need to experience the first P, pleasant emotion in my life. It doesn't mean that I don't experience unpleasant, sadness, anger, frustration. But if I don't experience any pleasant emotion, that's not good. So I need to have some things in my week that help me experience pleasant emotion. The E is engagement, having activities that I'm enthralled in, reading, gardening, you know, whatever that might be, in that state of flow. Relationships, quality over quantity, so people that I can lean on for support, trust, and care. M is meaning, so things that give me meaning in my life, you know, whether that's belonging to a footy team, volunteering, being really passionate about my work, or a role that I play in my family. And accomplishment is the A of PERMA. So having things, feeling like I'm getting mastery over things or doing things, even if they're quite novel, like in lockdown when, you know, we all learned how to bake bread. Just feeling like we're learning skills and developing things. And that's really, really important in keeping ourselves well. When we're doing those things, engaging in self-care, that's ticking off those boxes on an ongoing basis, our stress responses are reduced. We're more able to access all of the higher order thinking abilities like problem solving, evaluating, planning, that are really important for us to adapt to changing life circumstances as well. I think that, yeah, that part on self-care, I think, is really important.
Thanks, Anthony. I love that PERMA model. Anita, Lyndon, would you like to talk about how the genetic counselling role works with your patients and families that come and see you in that space?
Yep, sure, I'll jump in. So yeah, look, I think self-care is really important, and the evidence definitely shows that. And I think self-care looks different for everyone, and whether that's, you know, exercising or all different types of self-care. And I think that the conversation that I often have, especially with parents, is the analogy of putting on the oxygen mask first before you can help the person next to you. And I think I try and sort of frame it in a way that, because self-care as a mother can often feel very selfish and I don't have time for that. And I sort of frame it in the way that if you are not coping and if you are not able to get through the day and to cope, then there's no way that you can help your children and your family. And so actually, rather than thinking of it as selfish, you need to help yourself in the ways that, whatever that is, if that's counselling, if that's going for a run, if that's getting a massage, whatever that is, in order to then be able to be that support for the rest of your family and everyone around you. Because if you fall apart, and that will happen if you are not looking after yourself at all, then there's no way that you can help your children and your family. So that's kind of the way that I frame it. I was talking to a couple yesterday who have been through a traumatic pregnancy journey, you know, pregnancy after pregnancy, that just, whatever, they've had a really horrific journey. And we were talking about counselling and supports and everything, and they said to me, we've done a lot of that, and you know what, I think what works for me now is spending an hour going to the gym instead of spending an hour talking to someone. And I thought, that's great, like, you know now what works for you, and as long as you're prioritizing that time, that's really important. Lyndon?
And the only thing I add is, you know, all of those things are hard enough for parents who don't have a child with additional needs, or people who aren't parents in the world as it is at the moment. Everything is against us in terms of knowing who we are, and we're actually, you know, told that the things we need are things we purchase, even if that's the whole world is working against us. So actually, it's about prioritizing time and space to know yourself, and therefore make those decisions that know what is going to be meaningful and important and help you. And there's no way around it. It actually requires you to push the pause button on a day-to-day life, because otherwise you can't figure it out. So yeah, in the same way, and this is in the same context as Anita's been talking about, parental self-care is one of the big things I'm dealing with, and it's about focus on yourself. All of this is legitimate and all of this is hard, but the only way through is through, and that's finding some time to know who you are and what's good for you, and then apply it or implement it.
Thank you. That provides such such insight, but also the discussion about that mental health, that taking care of ourselves on an ongoing basis, that building that strong sense of doing things that keep us well all along the way, which as you've just alluded to, we often do in a physical. We take care of ourselves physically, but we don't think about the necessity to do that on an ongoing basis for our mental health. So I think that's a reminder for all of us of that mental fitness component that you hear people talk about, but often we don't give ourselves the time and space for that. So a question that I would ask the three of you as well, then, together as a partnership that is interested in ensuring the best quality of life for the rare disease community, what should we be advocating for? What should we be partnering in to be ensuring that people that can influence how progressive we can be in this space? Who should we be advocating to, and what should we be advocating for? Lyndon, maybe I'll start with you. Let's go the other way. Sorry to put you on the spot.
That's okay. I'm laughing because the other two are laughing because they already know I'm going to say something socialist, smash the system or whatever it is. I guess this is the thing. We need to think individually and we need to think systemically, right? And when we're talking from a community perspective, we know that humans have only ever existed in community, but again, we are in a society that says you are an individual and the individual is what matters, right? And so from a practical perspective, it is building our undiagnosed and rare disease community so that there's a united voice, and then using that as an advocate, as a platform for advocacy. We all know it's government, it's funding, it's all of that stuff. Like, if we could throw the money, that's fine. But the way that we break down barriers is forming relationships. The way that we remove things like discrimination is getting to know the person or the other. All of these things are actually, we can think of them as nice things, but they're essential to a functioning human society, an ecosystem, a functioning world, in fact. So all I can be thinking is we need to advocate collectively as groups. We need to connect with people that share a vision, share a viewpoint on the world and meaning, and then move from that space into blah, blah, government, blah, blah, all of that stuff. We can't do it alone. We can't do it as individuals. And that's, I think, where we need to put our energy. And then we will get energy back from those relationships, because that's the meaning of the PERMA, right? Which is these people enrich my life. They give me meaning, and then we've got a sort of a combined vision or voice to work with. Is that too vague, though?
Lyndon, I always enjoy your socialist tendencies. I think that's really important. That find the relationships, build the relationships, and have that shared meaning. And Anita.
Yeah, so agree with all of that. And I think, the tendency when we're talking about advocacy is to think about funding and we all think about that. We're all under-resourced and underfunded. And what could we do with more money? Obviously, would be amazing. What I would like to add is the importance and the benefit we see every day of support groups and peer support, and that is something that's so beneficial to all of the people that we're seeing, to be able to speak to somebody who knows what you're going through and has had a similar experience and can really understand you. I think, advocating for more and more of that. I think the peer support is so helpful, and having someone at the end of a phone line 24/7 who really can understand you and can just listen and empathize with what you're going through and provide maybe some practical support. I think there's always a role for formal mental health support for a lot of people, but I think that more sort of informal peer support is really, really beneficial.
Thank you for those words, Anita. It means a lot to the patient support community to be hearing that from genetic counsellors. We're often saying those things about genetic counsellors. So it's really lovely to have the role of patient support groups recognised back the other way, and that's a meaningful relationship. So thank you. That's really important. Anthony, did you want to comment?
The only thing I guess I'd add that maybe, Anita and Lyndon might feel slightly less comfortable saying, I think just in my work, I'm a psychologist. I've been really fortunate to step into this space, of genetics and genetic counselling. And I think the genetic counselling profession as a whole have, so many passions and are doing so much, having so many conversations to really be increasing what's available, increasing what's possible, trying to, talk with employers and managers and trying to change service systems. And so I think a very small, there's so many things I think that could be improved, but genetic counsellors, I think, are such fierce advocates. And so I think anything that we could do to really increase their visibility would really be doing just an amazing job. As a non-genetic counsellor, I feel really comfortable saying that, to really push the envelope on a lot of these things, because they are out there doing and having all of these conversations and doing just some amazing work.
Well, and you won't get any disagreement from us, Anthony. So thank you. I'm sorry, I was just reading the chat. Thanks, Claire. I will read that comment. Do we have any questions in Slido, Danielle?
We do. Thank you, everyone who's submitting questions. So while we may not be able to get through all of them, I do have one that's in line with our practical tools. So Claire does ask, do you have any advice for how trauma-informed principles can be applied to non-therapeutic interactions? For example, an information event or on an advisory committee?
Just with those principles there, I think they're really diverse in their application. And so, if I think about, voice and choice, like I think with choice, it's always a great option. Even if it's an information event, we don't quite know what might be distressing or triggering for somebody in that space. And so, just naming and giving people choice to say, look, if anyone wants to step out for a moment, you're very welcome to do that. Just normalizing any of those things people might need to do for their, own wellness. If we think about collaboration, checking through, what's everyone wanting out of this, trustworthy and transparency, just being really open about what we might be talking about or covering, so that people can expect things. I think these principles can be really translated quite well to a range of different areas. And so, I think helpful for, a range of reasons there, but I think those will be really useful questioning tools.
And can I add a little thing to that, in terms of thinking about involvement, or you even mentioned being involved in a advisory group and things like that, I guess I'm coming from a researcher / professional perspective. You know, we set up programs, we have ideas about what we think is important and good, and we're holding, you know, genetic information, complex science information, and every now and again, it's entirely feasible that we will lose sight of other things that are of value to the community that we're trying to serve. And you know, we're setting up we've had consumer engagement group for a while for ID now, and we're now setting up a parental advisory group as well, which is this idea that they know their children in a way that we do not know them, and we will never be able to know them, but it's the things that are important for their children. But also then they've been through the experience, they know that parts that might be trauma, you know, trauma points, or whether it's the overall thing, you know, process or journey. So I'd be encouraging people, you know, we're naive and we are blind. We are professionals, we've got good motivations, but we actually don't necessarily know what the experience is. And the only way we can get even a glimpse of that is to hear from people. So if people have capacity in their support group roles, or as parents, to get involved in those types of opportunities, because actually then it gives us more to work with, rather than just, look, we've got this fancy new technology that we're going to apply, let's go.
Thank you. That was a great question, and I think that being involved and help share that our journey with your expertise, our expertise, that partnering together, I think has been a message that's kind of come through in a number of different ways through this presentation. And unfortunately, we're out of time. So, but we will respond with your help, Anthony, Anita, and Lyndon, to questions that we have on Slido. I'd like to say a huge thank you to the three of you for your time, for your insights, for sharing and giving us such a deep understanding that we don't often get from our side of the table. So thank you so much for sharing that. And I can see this, and I hope this is okay, but I can see this as the beginning of an ongoing sharing, an ongoing discussion, because I think it's so hugely valuable for us to understand where you're coming from. And also taking Claire's point in the chat too, it helps us as support groups to support our community in being engaged with community that is experiencing trauma on an ongoing basis as well. So it helps us to understand better and to have the tools and to have the insights that allow us to better serve our community as well. So thank you everybody for your time and for coming along, and join us for our next mental health event, which is an exploration of a mental health toolkit and some of the research that has been developed by or undertaken by Rare Minds in the UK about the rare disease community. So thank you so much for joining us, and I hope your afternoon is a great one. Thank you.
Thanks.
As people are switching off, I just want to say the slides will be shared as well. So we'll send a follow-up email.
Thanks, Danielle. Thanks so much, Anthony, Anita, and Lyndon. It is unbelievably helpful to have you guys come along and support us at an event like this, but to talk about your experience and how you go about preparing to work with the community. It is really, really valuable, and it's making me think we often come and talk about ourselves. We don't often ask you to talk about yourselves, and And we need to do that more, because that creates much better partnership.
Yeah.
So thank you so much.
Yeah, and thanks for having us, and also appreciating what we do. It goes both ways, and I think, yeah, that community and connection is really important. I'm going to have to run, but yeah, thanks for having us.
Thank you.
Thank
you all.
Thanks, Anita.
Yeah.
Thanks, Anthony. Thanks,
Bye-bye.
Lyndon.
And Anthony, I'll email you, if that's okay, some of the questions that I received. They were really nice to have a patient perspective, a support group perspective, and it seemed like a health professional perspective. So something that we could summarize would be really helpful for the post-event.
Not a worry.
You are so on point, so I'm quite touched
Thank
of
you.
your content. So wearing a few hats, just so relevant to finally understand what trauma-informed care means when you hear it so often with those diverse hats of being a patient, as well as you know, in the advocacy space. So yeah, your slides were just very valuable. Thank you.